Good afternoon, everyone. Good afternoon to those of you who are with us at the conference room, as well as those of you who are watching this conference online as well. I believe there are a bit more than 10 people who have registered to follow us online as well. This is our periodic press conference with regard to the ongoing novel coronavirus disease crisis. And we'd be more than happy to present you with all the information necessary, as well as answer all the questions that you have for us as well. Today, we have some handouts for you. We have sent them online by email to all the viewers online. And in case you haven't received them, do let us know, and we will send you one as quickly as possible. Today we have three other speakers with us. On my right-hand side, on my immediate right-hand side, I have Mr. KOJIMA from the Cabinet Secretariat. Mr. KOJIMA, Masaru KOJIMA, he is the Councilor in charge of Coronavirus Disease 2019 Preparedness and Response. We also have, to his right, we have Mr. SAHARA, Yasuyuki SAHARA, who is the Senior Assistant Minister for Global Health, Minister's Secretariat at the Ministry of Health, Labor, and Welfare. And to his right, we have one more person from the Ministry of Health, Labor, and Welfare, and he is Mr. UMEDA, Hiroshi UMEDA, who is the Director of Infectious Disease Information Surveillance Office, Tuberculosis and Infectious Disease Control Division, Health Service Bureau at the Ministry. Okay, without further ado, perhaps we should start with the opening statement from our main speakers. Perhaps we can start with Mr. KOJIMA. Mr. KOJIMA, you have the floor.
Thank you very much. My name is KOJIMA. I'm from the Cabinet Secretariat. I would like to, at the outset, talk about what happened on the 4th of May. The Japanese government, which originally said that the declaration of emergency status would go on until the 7th of May, but that was extended to the 31st of May. So I'd like to give you an outline of this. On the 7th of April, the declaration of emergency status was made, and it's almost been 20 days. And reducing contact between people by 80%, that was the goal toward which efforts were made, and the citizens have made great efforts. So we'd like to express our gratitude. Due to efforts on the part of everyone, we have not seen an overshoot. We have been able to avoid that. So the daily new infection cases are now on the decline. We're able to manage that. And the maximum was beginning of April, where new infections went to over 700 per day. There was an increase of over 700 per day. But recently, it's under 200. Yesterday's data says 93. So new infections are on the decline, and that is the trend. And as to the effective reproduction number, the R number, the overall nation figure is 0.7, under 1. And so without a lockdown, we were able to avoid an overshoot, and we're on the track toward containment. On the 4th of May, the expert meeting was held, and there was an analysis of the infection status, and future recommendations were made. And there are two of these. Firstly, in Japan, we have not gone to an overshoot situation as in the other countries, and the R number is under 1. We're seeing certain results, but at the present point in time, there's a considerable number of new infections, and the reduction of infections is not adequate. That's the first point. And the other point is that the medical system is still overstretched, so the present approaches need to be continued. And this is the view of the experts. Based on the views of the experts, on the 7th of April, the emergency status declaration was made, but this was extended to the 31st of May. As to the areas, it will be all prefectures. It's all prefectures. So there's no change to the previous framework. It will be applied to all prefectures. However, with a view to doing so on the 14th of May, the expert so will be consulted once again, and the regional infection trends and the strain on the medical system will be analyzed in detail by the experts. And if the judgment is made that it's possible, without waiting for the 31st of May, the emergency declaration will be lifted. There are 13 designated prefectures under specific caution. And with regard to these prefectures, we will be asking them to continue efforts to reduce contact by 80%. On the other hand, as for other prefectures, the other 34 prefectures, prevention of infection increase and continuation of economic activities, we will consider both to take phased steps. Up until now, for example, if there have been no emergence of clusters, and with regard to facilities where the 3 C's can be avoided, with a thorough prevention measures, there'll be a relaxation or lifting of closures of business, and that will be studied. For those concerned, for prevention of spread, travel and travel across prefectures or unnecessary transfers, we will be asking them to control that. And this is a stage of preparation for the next step. That is what we consider this phase to be. So bearing in mind that this may be a long-term situation, we've had proposals with regard to new lifestyles, various commercial facilities, restaurants, operations, and small-size event operation. With the consideration of this new lifestyles, taking full measures to prevent infection, we hope that activities will be resumed, taking all of these into considered. We will have experts to collaborate to create guidelines for prevention of infections for each of the business types. And the approaches which we have taken in Tokyo have produced sure results. So we would like to ask for continued cooperation. That is all from me. Thank you very much.
Which of the handouts would be relevant to your presentation just now?
The document that's titled Summary. The summary of the basic policies. Please refer to this material.
Now I would like to give the floor to the Minister of Health, Welfare, and Labor. Perhaps Mr. Sahara will be giving the statement. You have the floor.
Yes. My name is Sahara from MHLW. Thank you for your attendance. At your hand, distributed is a copy of the material titled Updates on COVID-19 in Japan. Please refer to this material as I speak. This shows the status of infections, the testing systems and infrastructure. That is what I would like to explain. If you could please turn to this page. This shows the latest status. As is shown on top right, this shows the status as of yesterday. Please take a look at the total at the bottom. PCR positive. 16,219 compared to the day before, increase of 95. And those who are Those who are hospitalized, 11,442, decline of 339. Those who have been discharged from hospitals, 6,557. And the number of deaths, unfortunately, 570, an increase of 6 compared to the previous day. If you could please turn to the next page. This shows the number of confirmed cases who's tested positive. As Mr. Kojima said, in early April there was a peak, and now the number is on the decline. With support from many people, we're now seeing the number dropping. Please take a look at the next page. This is by age group. The trend has not changed very much. You can see that there is a large number of young people who are tested positive, who have tested positive. The next page. This is the number of death by age, or the number of severe cases by age. I think this is common throughout the world. Those who are elderly are seeing the largest number of deaths. There are those who have suffered severe symptoms are having greater numbers of death, and relatively less death among the younger generation. Please take a look at the next page. Overall, the number of infections, the number of patients who have been infected, on a day-to-day basis, the number is declining. At one point, hospitals were very overburdened. In some regions, the tough situation still continues. Please take a look at the left-hand side graph. This shows the number of patients requiring mechanical ventilators. This is a plot of those numbers on a specific date. And the peak was toward the end of April, and it's improving gradually. On the right is a graph showing the number of patients who are on ECMO. There's a slight decline in the number. But then, of course, we have to continue to closely monitor this situation going forward. Moving on to the next page. This is a comparison of Japan versus other countries. This shows the number of deaths as of April 4th. The number of deaths per 100,000 people, how Japan compares with other countries. Fortunately, the number of deaths in this country is very small. And it's desirable that we sustain this trend. Next on PCR testing. Please refer to the next page. This is something that we show every time. Red represents the testing capacity per day, and green, or rather blue line graph, shows the actual number of tests performed. The testing capacity is gradually improving, and it's now close to 18,000 tests. The number of actual tests performed has not reached the overall capacity. It's hovering between 7,000 to 8,000. There are some ups and downs, waves, and that's because On the weekends, the number of tests performed becomes less, and reports are sometimes delayed with a time lag. If you could please take a look at the next slide. This is the number of PCR tests conducted in each country and region. Comparison among countries. Orange bars show the number of tests per 100,000 people. As is always pointed out, the number of tests performed in this country compared to other countries plotted here is quite small and limited. And it's pointed out that this may be a challenge. But for that, please refer to the next page. This shows the PCR test positive rate in each country and region. So the rate of positive findings, if we compare Japan with other countries, the rate is lower in this country. If this rate is high, then there may be a challenge. But the rate of those found positive is low in Japan. So I believe that the testing infrastructure and the framework is working. And it's not that we're missing a large number of people who are supposed to be on test. That is not the case. And moving on to page 11. The bar graph shows the number of PCR tests conducted, and the line graph shows the rate of those found positive. The rate of those who are positive in early April, when the declaration of the state of emergency was issued, it was very high. But you can see that this rate is coming down as testing infrastructure is developed and improved. The number of patients has declined, and that is in the background of this, from what we can see. Now going forward, well, so far with respect to PCR tests, we targeted mainly severe patients for PCR testing, so that we will not miss those severe cases. And the number of infections has risen since the beginning of April, but now, of late, more recently, the number has come down. And PCR testing capacity and infrastructure, because we do not know what the situation will be in the future, we believe that we need to continue to strengthen the capacity and the framework. Responses and actions for that are described on the next page. This is based on the recommendations made by the experts group. There are 6 of them. One is to strengthen the system of public health centers and local public health institutes and reduce their work burden. Second, with respect to the testing infrastructure, we need to increase coordinating functions between and among prefectures. Testing capacity needs to be arranged and coordinated within the prefecture, and I think we need to facilitate that and improve it. Number 3, establishment of regional outpatient inspection centers at the end of March, early April. From that point in time, in various regions, we are introducing new methods of testing Until that point, tests were conducted only within hospitals, but outside hospitals, tests have started to be commissioned to local medical associations. Tests are performed for those who are judged to be necessary by their doctors. And we have been introducing these regional outpatient inspection centers. We need to reinforce that. Number 4, with respect to PPE, sample collection kits, and testing kits, we need to secure them. In February and March, there were challenges with respect to this, so we need to continue weather measures to improve this. Number 5, training for sample collectors. And we also need to ensure the quality of PCR testing. We need to continue working on this. Number 6, we need to grasp the status regarding the PCR testing systems. We need to continue to closely monitor the rate of those tested positive. We need to disclose that information to the general public. And these are the recommendations that we have received from the experts. And as MHLW, we would like to continue working on these. And 2 more pages. On top of PCR tests, we are developing an antigen test. Unlike a PCR, which takes hours to get the findings, it takes much shorter time. It takes only 20 to 30 minutes time to test on the spot at hospitals. And so the test results can be delivered much more quickly. PCR tests were performed for those who were deemed necessary. But once we have this antigen test, people who test positive will have that information and will be found to be positive. But those who test negative, PCR testing can be performed on top of that so that we can increase efficiencies in performing PCR testing going forward. 2 more slides. If you could please take a look at the next slide. This just shows the image of the outlook that we have for novel coronavirus disease control measures. This was suggested by the experts group. There's a big peak on the left-hand side of the graph, and we have just started to peak out, and we're on the right-hand side of the slope. With requests for thorough behavioral modification, we would like to drastically contain the number of new infections. That is what we're working on currently. You can see that the curve goes down, and with the spread of the new lifestyle, and with this new lifestyle maintained, we would like to contain the number of new infections. What is necessary during this period is, as is stated at the top, we need to observe the new lifestyle. As Mr. KOJIMA said, we will take a number of measures: social distancing, ensured telework to be promoted, and these are the measures necessary. Now, during this period, we all need to observe this. Right below where it says new lifestyle, we need to expand the capacity for the healthcare system. if there's going to be another peak in the future, so that we will be able to respond to that adequately, we need to increase the capacity. And as is shown below, we need to increase counter cluster measures. And we don't know what the future holds, but if there's going to be another wave of infections, we will make a request for thorough behavior modification. This could be the case. And on the right-hand side, what is important at any rate is to develop a framework in which early diagnosis can be delivered, and to develop treatment methods to prevent severe cases from happening. Remdesivir, a new drug, was approved yesterday, and it's now to be used. And Avigan will be approved. Avigan is approved, and it's now being tested in clinical studies. So try to introduce these drugs as early as possible and continue with the development of vaccines. So in the overall picture of what's to happen in the future, we need to continue these measures and activities. The last slide. This is the future policy for novel coronavirus disease control. For one of the major points here is behavioral modification. I may be repeating, but the focus is on new lifestyle and counter-cluster measures. Need to be carried out even more effectively. And we need to provide full support to local health centers. And we should look to leverage ICT so that we can perform contact tracing better. And to reinforce the healthcare system, the medical system, and development of treatments, we need to continue making an all-out effort at all of these. Of course, the number of infections, how will it evolve? We do not know yet at this moment, so we have to be very careful. We all have to play a role in responding to this. In the future, these are the measures we believe are necessary. Thank you.
Thank you, Mr. Sahara. And I hope all the viewers will be able to look into the material, the handouts that Mr. Sahara used as well. They contain quite a number of interesting figures, useful figures as well. I think one of the points he made was the expansion of the PCR testing and other types of testing as well. One thing that has been said in the last couple of days, and which was announced by by Minister Kato, was the rough guideline for PCR testing. In Japanese, we call it the meyasu. Some people translate it as a guideline or criteria, but I think it's more of a rough guideline. So it's there's a lot of flexibility. Doctors do not have to stick to this rough guideline. Ultimately, it will depend on the doctor's decision whether the patient or the person should be taking PCR tests or not. And we are reviewing this rough guideline as well. Sahara-san, is there anything to add on this point?
Thank you very much. The point that was just made, I think, needs to be divided into two aspects. The first aspect being what the doctors do. What kind of patients will the doctors conduct PCR tests on? Since the beginning of March, it was already said that this is to be left up to the doctor's decision. So that was the case since the beginning of March. And the other point is to the outpatient. What kind of people should go to the outpatient clinic for those that have contacts? For returnees and potential contacts, consultation centers, what kind of people should go there? This would be a guideline, a rough guideline for this. Presently, 37.5 degrees centigrade. If this fever lasts for 4 days, this would be the criteria. That's the present situation. It's just one rough guideline. If there are underlying conditions or if the person is suffering, we encourage people to consult regardless of this criteria. And the centers say that people do not have to stick to the criteria and that they would refer them to doctors. What is going on the ground is such that in some places, they try too hard to stick to the criteria, and it's hard to be subjected to tests. We hear voices to this effect. So the rough guidelines with more flexibility is something that we are studying, and we're in the process of studying more flexible guidelines. And at an earlier point in time, so people can be given tests. That is the earlier stage of symptoms so that people can be subjected to tests. We're exploring possibilities for enabling that. What kind of criteria, what kind of wording would be the best? We need some time to work this out, but we would like to indicate at some point in time.
In a nutshell, the government to promote the actual PCR testing amongst our people as well, and we'll be taking all sorts of different measures to make this happen, as we have been for the past month or two as well. Now that the opening remarks have been completed, I would now like to open the floor to questions. And I just realized that I hadn't introduced myself properly. My name is Masato. I'm the press secretary of the Foreign Ministry, and I'm happy to be able to convey all the important information to the foreign correspondents in Tokyo. Perhaps I should open the floor to those of you who are at the conference right now. Any questions that you would like to pose? Yes. Okay. The lady at the front.
My name is Nishimura from Radio France, a correspondent. I have several questions regarding PCR tests. In the material, it says that this is the number of PCR tests conducted. Those who are hospitalized because of the infection, are they tested, and are those numbers also included? If so, how can we see the breakdown? How can we see that number? That's my first question. And I would also like to ask how you calculate the rate of positives. The definition of positive testing differs from one country to another. Here in Japan, how does MHLW calculate the number of those found positive? And antigen tests. At the end of last month, I understand the government conducted a very small trial or test. Have the results come out? I have not confirmed all of that, but if the results are out, how can we get the results? How can we see the results?
Three questions are for the Ministry of Health, Labor and Welfare. Are the questions clear for you, Sahara-san? Okay.
Please bear with us for a moment. With respect to the numbers, those who are hospitalized, well, sometimes the number of tests include tests performed on those who are hospitalized. Well, the question perhaps is not just at the time of admission testing is performed, but testing is conducted second time, third time round while they're being hospitalized. And are those numbers included was the question, I believe. We look at both statistics. We take a look at the total number of tests performed, and we also look at the number of patients. 2 tests may be conducted for one person, and sometimes that is counted as just one test. We have both statistics. According to this material, if you could please take a look at page 3. This says the trend of the number of confirmed cases. This shows the number of persons, the number of patients. This is not the total number of tests. This shows the number of persons who have received tests. Page 9, this shows comparison amongst several countries. This shows the total number of tests, the number of tests performed. So, for each country, what does the number represent? What numbers are collected? It is different from one country to another, and that may be a challenge.
確認したいんですけれども、
I wish to confirm the following. Right over here, the number shown here includes those who are hospitalized or those staying at hotels who have been subjected to tests second and third times, and that's included. If that's the case, the more you see an increase in infected persons, number of infected persons, the test number would automatically go up. The second and third tests would lead to an increase in the number. Now, the new tests may be flat or even decline in terms of possibility. Would that not happen? The red page 8, what is you see on page 8, that's the total number, and it's exactly as you've said. And so, therefore, the second test would be included. Tests such as the second test would be included. And so that includes all the tests. And as you pointed out, if you subtract the second number, if you're looking at just the initial test, the number would be smaller, and it's exactly as you've mentioned.
補足しますと、厚生労働省の方
On the Japanese version of our ministry's website, we show this graph, and it's based on the number of persons per day. How many persons have received PCR tests? How many of them tested positive? We show that every day on our website in Japanese. So, for that particular day, what is the number of newly infected people? You will be able to follow that number by taking a look at our website.
それから陽性率は
On the positive rate, basically, the number of tests performed would be the denominator. And those who have turned positive would be the numerator. And the last question that you raised on antibody tests, the antigen tests rather, or the antibody tests we are in the process of doing at the moment. And so we will show you the results going forward, the antibody tests.
Okay, thank you so much. Questions from the floor? Okay, Rocky-san.
Thank you very much. Rocky Swift at Reuters. Last night the news came out that remdesivir was approved for use in Japan. That would be the first one approved in the US and Japan, I think, anywhere in the world. Is there any more clarity on when those supplies of that drug might come to Japan? And a related question, Sahara-san, you mentioned Avigan. I think you said that that drug has been approved, but to my knowledge, it is expected to be approved by the end of this month. At least that's what Prime Minister Abe has said. So if you could clarify on that. And additionally, is there any expectation for when Avigan might be approved similarly in the United States and other countries, seeing as remdesivir was speeded through the process so quickly in Japan? Thank you.
Okay, thank you so much. We actually have a similar question coming from Isabel Reynolds of Bloomberg, which states, can you explain the reasoning behind the rapid approval of remdesivir as well? So in giving us the update on remdesivir, could you also cover this point as well?
Hi.
Yes, thank you for your question. First, regarding remdesivir, we had a special approval for this drug. Well, special approval is such that it's different from ordinary approval that we give to drugs. This was especially approved. More specifically, there were three conditions or three ideas behind this. One is, in order to prevent the spread of the infection, we needed the drug to be used in emergencies. And I think that condition is met. We need urgent use of the drug. Second, other than this particular drug, there were no other appropriate measures we can take to treat the disease. It's not that there are other drugs that are available that can be used for the disease. This is the only drug so far. And number three, in overseas, the drug must be approved. In the case of remdesivir, it was approved by the FDA. So given these conditions, special approval was given. And the target population is severe cases, severe patients who require mechanical ventilation will be put on this drug. Remdesivir is a clinician-led trial. It was a joint trial between Japan and the US that's been conducted. And given that as well, we decided to give special approval to this drug. And regarding Avigan, I don't think I specifically said that it was approved already. For its approval, clinical trial is being conducted. That is where we are right now. At the earliest possible stage, we would like to see the clinical trial concluded so that we can have a review of the submission to confirm that it's safe and effective. And if that is the finding, then we would like to give approval so that it can be supplied to the hospitals quickly. What is important here is to collect the evidence for that. And for that, various medical institutions are involved and are working on this. And remdesivir, when will the supply start? When can it be used? At this moment, we don't have a specific time schedule yet, but remdesivir already had a clinical trial, so it's been used on some patients already. Post-approval, when can it be made available? The date is not set, so let me refrain from answering that. The timeline has not been set yet. And sorry, Avigan? Actually, it's approved as a drug already with the indication for a new type of influenza. A clinical trial is conducted with this drug, and that is to expand the indication so that it can also cover the novel coronavirus. So that is what is being done.
Okay, thank you so much. I think that the point was for Ravigan, it will have to go through rigorous evidence-based examination. And after all that, then we will know how this new drug will be treated in Japan as well. Okay, we have
すみません。それからアメリカでの
If I may, the use of Avigan in the United States, or the prospect for approval in the United States of Avigan, we can't say anything about it. But as a fact, Avigan has already, under approval of FDA, has started clinical trials with FDA approval. And so therefore, there are many patients where Avigan is used. And if the data is in place at an early point in time, very smoothly, smooth pharmaceutical approval should be coming.
We'll a number of questions from the online viewers as well. So perhaps I should introduce. I should use these questions. We have some questions coming from Mr. Patrick Welter of Frankfurter Allgemeine Zeitung. The first question is, this is probably for Mr. KOJIMA. What are the criteria by the national government for lifting the state of emergency, and why don't the government give some concrete numerical criteria for lifting the state of emergency?
Thank you for the question. The criteria for lifting the state of emergency. At this moment, we cover the whole of the country. All 47 prefectures are now under a state of emergency. Going forward, if we are to lift that, it will be region by region. Should it be lifted for the prefecture, for the region, that will be a regional discussion and decision to be made. Well, then specifically, which prefectures could lift the state of emergency? The criteria for that are now being debated. In terms of the thinking behind that, for one thing, the status of infections. What is the status of infections in that particular prefecture? For example, in the last 2 weeks or 3 weeks, what's been the number of new infections in that region or prefecture? What is the proportion of cases where the routes of infections are unknown, untraceable, or the status of infections in the adjacent prefectures, adjacent regions? Overall consideration will have to be made, taking into consideration such factors. And the system of healthcare system, how well is it established? How well can the system accommodate the patients? So those two factors will have to be looked at intensely. Can the prefecture handle a number of severe cases? At any rate, it will have to be evaluated by experts, and an overall consideration will be made, taking into account a number of factors, as I said. And in terms of the time schedule, 14th of May, that's next week. On the 14th of this month, experts will meet, and at that point in time, for each prefecture, the trends, the number of new infections will be looked at. Healthcare delivery system will also be evaluated in detail by the experts. And if possible, before the end of May, the state of emergency could be lifted in some prefectures, possibly. At any rate, as experts evaluate the data and consider criteria, they are saying that they would like to take a look at the data up until the 14th. So based on the input from the experts, we hope that quick decisions can be made on that.
Another question we have from Mr. Welter is, when and under what conditions will Japan lift the restrictions to travel to Japan? We also have a similar question coming from Isabel Reynolds of Bloomberg, once again. Can you explain what discussions are you having about when and how foreign travel can be resumed? Kojima-san, can you take this question, or should I answer this? I think the travel ban itself is an all-government effort, and one relevant factor for this travel restriction is the travel advisory issued by the Foreign Ministry as well. We have currently over close to 90 countries at level 3. And these are countries indeed that we need to look at very carefully for the Japanese people to travel into. But based on that, the relevant ministries, including the Ministry of Justice, the Ministry of Health, Labor and Welfare, and some other ministries will look into what should be done under their jurisdiction, including passport control, or for the Foreign Ministry would be whether visa should be given or be valid or not, and whether people traveling into Japan should be properly tested health-wise, and so forth. So it's an all-government decision, but as of date, we have not seen any changes or relaxing in the travel advisory that I referred to. But we will be responsive to how things are in the other countries, how the novel coronavirus is becoming more or less under control or not. And based on that, we'll make some judgments. At this point in time, it would be difficult for us to say when that will happen. But we are certainly vigilant as to what is happening around the world as well. And eventually it will depend on how things are in Japan as well. If things are more or less under control in Japan, we will look into this matter as such. Another question coming from Isabel Reynolds of Bloomberg is, I think this is probably for the Ministry of Health, Labor and Welfare. Officials said in earlier briefings that you are finding 80% of those infected do not infect anyone else. Is this still the case?
はい、それは
Yes. As you said, that sounds true from what we see. Yes.
Okay, thank you, Mr. Sahara. Anything to add?
このは
The 80% not being infected is data from February. MHLW has a cluster team, and we're very actively doing contact tracing. And this approach was taken not only in February, but in March and in April. We have continued this. And in continuing these approaches, we have not changed our way of thinking throughout the process.
Thank you so much. We have some more questions coming from other viewers online. We have a question from Mr. Alistair Gale of the Wall Street Journal. His question is, can you explain how Iwate Prefecture alone has managed to have 0 reported COVID-19 infections? Is this because of the very low level of testing there? So could I ask the Ministry of Health, Labor and Welfare to address this question?
Yes. I was taking a look at the data just now. With respect to Iwate Prefecture, between March 25th to May 6th, during this period, the number of PCR tests performed was 263. 263 tests are performed in Iwate during this period. So this was the number of tests conducted. None found positive in these tests. Why? It's difficult to say why or explain why. Most probably, people in Iwate Prefecture are taking these measures very seriously. They're implementing these measures very seriously. They are not urban centers, so perhaps social distancing is effective. There must be a number of factors, although it's difficult to explain.
Okay. We have questions coming from Simon Denier of Washington Post. Actually, 2 questions. One is, data from the National Institute of Infectious Diseases shows a significant number of excess deaths due to respiratory tract infections in Tokyo in March. Given that the flu season ended early this year, how do you explain these deaths? Could they be diagnosed COVID-19 deaths? Health? Okay, I will repeat. Data from the National Institute of Infectious Diseases shows a significant number of excess deaths due to respiratory tract infections in Tokyo in March. Given that the flu season ended early this year, how do you explain these deaths? Could they be diagnosed COVID-19 deaths?
はい、
Yes. My name is UMEDA from the Health Bureau, the Health Service Bureau of MHLW. As you said in the question, the influenza season from December to March, death due to influenza. We've done surveillance for speedy process. And in large cities in Japan, 21 large cities, we've done the surveillance. So when we do the survey, and the infection route is on the website. In one city as a whole, if we look at the results, the excess death was not seen this season. On the other hand, if we look at the respective cities, there are fluctuations, ups and downs in the data. Temporarily, we can see an excess death situation. And this is seen in a multiple number of cities. But if we focus on Tokyo, in the case of Tokyo, the 23 wards, we've collected data from these wards to see if there's excess death situation or not. And if we look at the data from the 23 wards, as stated in the question, in February and in March, we've seen excess death. And that is shown on the graph. And as you pointed out, this season was such that the influenza was very small in number. Cases of influenza was very small. Despite that, we're seeing excess death situation. And your question is as to why, what caused this. And for our part, we've done some work for confirmation. There was very small number of influenza this season. And as for data which is counted, among those died, pneumonia, that is including aspirational pneumonia and also pneumonia due to bacteria. We've counted deaths due to this. The number was such that if we look at the season starting in December, from that point in time, there was a small number of influenza cases, but deaths due to pneumonia during this time was on the decline. That was the actual situation. And why do we see an excess death situation despite the small number? Now, for one thing, the baseline, the past 30 years of cases where influenza was not very widely spread. The past 30 years of pneumonia and influenza death cases, statistically, was calculated so that it's a 95% confidence level. And we're seeing a tendency or a trend along this baseline. From the latter part of February to March, including Tokyo, this is seen in other cities, but we're seeing the general trend is toward a decline. On the other hand, the excess death rate was that while the baseline was going down, there are reports from public health centers in the 23 wards. And during this time, there was only a small number of reports from these public health centers. The number itself is small, but the reports per public health center even if the number doesn't change much, it's very difficult to explain this, but if there are only a few number of public health centers reporting, because the reports are small, the number of reports are small, we need to make adjustments for the 23 wards if there's only a small number of reports being filed. And we provide estimates based on adjustments, and that's the surveillance model. And if we use this estimate, the estimate figure doesn't change much, but because also due to the fact that the baseline goes down, there's an excess compared to the upper limit of the baseline. And so that is why we're seeing this result of excess mortality. The excess mortality, when we see this trend, this surveillance would enable us to react very quickly, and we would evaluate with experts. The actual number has gone down this year, and there were only a few number of public health centers reporting. So if you just look at the numbers, we're seeing some excess situation. So that's the case. It's not that this year there are more deaths due to pneumonia. That is not the case. We are not seeing such a situation. That is how we evaluate the present situation.
Okay, thank you, Mr. Another question coming from Simon Denier is as follows. Kobe City General Hospital surveyed 1,000 outpatients in the first week of April and found 33, or 3.3%, had antibodies for COVID-19. This would represent an infection rate for Japan 300 times higher than the official figures show. How do you react to that study?
Thank you for the question. First of all, with respect to antibody testing, as is said by the WHO, the testing system itself is not yet well established, and there's still room for interpretation. There's a lot of debate on that. So Kobe City Hospital number is something that we would like to take a look at as one of the numbers, but we are conducting various surveys and investigations. And so we have to look at this number from an overall point of view to put it in perspective. If the number of infections is 300 times the official data, we would see a much larger number of new patients, but that is not the case. So we have to think. Antibody testing results have to be looked at, taking into consideration a number of factors. And so we should not just focus on one test. We need to take an overall look.
This is a that attracts some attention, but the fact is that the size of sampling is a bit limited. And I think it would be interesting to see Kobe City General Hospital actually perform its second or third surveys as such and see how things have changed over time. I think it's been a while since the first week of April, and I think it would be interesting for everybody concerned to see how the figures actually change over time. Okay, we have some questions coming from Motoko Rich of New York Times. And I think the first one perhaps should be addressed by Mr. KOJIMA. The question is, when the state of emergency is lifted, how will you guarantee compliance with a new lifestyle? This new lifestyle that was suggested, proposed by the group of experts on the 4th of May.
Thank you for the question. The expert meeting that met recently proposed the new lifestyle. That is to contain the expansion of the infection. At the same time, social and economic activities to gradually resume this. This sort of new lifestyle must be thorough, and it needs to take root. And that is the thinking. It's not that we can say people should do this and that. It's not something that we impose on people. It's for the citizens to unite, to save lives and livelihood, to muster their wisdom, and to be thorough in their digitalization and conducting smart lives. It's for each and every citizens, and we need their cooperation. And fortunately, the Japan's special measures law framework is a very loose framework, but we've had cooperation from the citizens, and we have come this far. We've been able to prevent an overshoot, and we've been able to contain the situations to the present level. So with cooperation from the Japanese citizens and with their understanding, we have seen them conduct a behavioral change and modification, and we should continue that, and that is necessary. It's necessary that this be continued. And naturally, for the new lifestyle, the government would be calling on people to wear masks or to wash their hands or to avoid the 3 C's. We'll do public relations and providing of information on the part of the government, internet videos and posters. We will be leveraging various forms of media to appeal to the general public about the need for behavioral change. And teleworking and staggered commuting, we've requested economic organizations on these points, and industrial associations for each of the industrial associations and type of industry and type of facility. We have been asking them to form guidelines for prevention of infections. So in various forms, we hope that the new lifestyle will take root, and we're making requests to this effect. We continue to receive cooperation from the citizens.
Okay, and in this relation, we have a few more questions from Motoko Rich, as well as Walter Sim of Straight Times. One of the questions is about universal mask wearing, which is one of the things included in the new lifestyle. Will the Japanese government be recommending universal mask wearing when people go outside indefinitely?
Thank you for the question. Indefinitely, I'm not sure, but I think there was a page from MHLW's presentation earlier that I can point to. There's an illustration. This is the page that I'm referring to. Yes, this is the page. As was mentioned earlier, we really don't know about the future, but the number of infections may rise or decline, and for a certain period of time, that will repeat, perhaps. And so for the time being, when people go out of their homes, we want them to wear masks. And we want them to be thorough in observing that, implementing that. Will that be permanent or indefinite? It depends on how well the disease can be controlled going forward. So for the time being, we ask the citizens to continue with their behavior changes.
This is from Welter Sim of Straits Times once again, and it's about the same matter from a different angle, perhaps. The question is, how concerned are you that people will let their guard down when the state of emergency is lifted? For example, South Korea's Golden Week holiday has led to a small but growing nightclub clusters.
Thank you very much. Before the declaration, there was a 3-day holiday in March, and people actually let their guard down, and that led to increase in infection after that. So based on this reflection, the May Golden Week, during this time, we asked for thorough behavioral change or self-restraint of going out or going to different prefectures or unnecessary travel or returning to their parents. We've asked people to refrain from doing that. And as a result, during Golden Week, if we look at tourist spots, using mobile phone data, derived data, and so forth, near Tokyo, in places such as Karuizawa, compared to Golden Week last week, there was a reduction by 90% reduction of people. And in Mie Prefecture, Issei Shrine, over a 90% reduction of people was seen. And this time, we've had tremendous cooperation from the citizens and we were able to generate these results. So that people will not let their guard down excessively. We'd like to continue to monitor. And the new infections tendencies and the spread of infections, we'd like to continue to monitor to respond appropriately.
Thank you, Kojima-san. And Kojima-san, in this relation, we have one more question from Welter Sim. I think he wishes to have more elaboration on the exit strategy. His question is, could you elaborate on the factors that Japan will look at in devising an exit strategy? The factors in the exit strategy. And in this relation, will this new lifestyle mean the end of businesses, some businesses where avoiding the 3 C's is impossible, such as karaoke outlets and izakayas?
Thank you for the question. At this moment, on the 4th of May, the Japanese government announced basic policies regarding the novel coronavirus disease control. And it has included a number of ideas with respect to restrictions on the use of facilities. Those designated 13 prefectures under specific caution. In these prefectures, if the facilities have the risk of spreading infections, the measures need to continue and restrictions continue to be in place. For other 34 prefectures, if the facilities have not had any cluster infections on the condition that they take necessary controls, their use can be resumed gradually. If the facilities have had clusters and if there's a risk of 3Cs, then restrictions are requested to be continued. So economic activities will be resumed gradually as such, and in view of the measures that are necessary to be put in place, we will take gradual steps to resume these activities. So in places where clusters have happened, in facilities where 3Cs are a risk, or nightclubs and nighttime restaurants where clusters are prone to happen, then restrictions will have to continue. Otherwise, for other facilities, the restrictions will be relaxed gradually, depending on the prefecture or the region.
Okay. I have another question for the Ministry of Health, Labor and Welfare, actually. And this comes from Motoko Rich of the New York Times. How can we be sure that the low number of deaths in Japan is not just a matter of many deaths not classified as COVID-19 because you're not testing patients before they die? So it's about the testing of patients who have died of some causes.
Thank you. This is a type of question that we get all the time. Basically, those people that die, they die in hospitals, and in hospitals, PCR tests are conducted because insurances are provided and doctors make that decision. And if it's pneumonia, or if we feel that people have severe cases of pneumonia, in Japanese hospitals, there's no hospital in Japan that would not doubt it's due to COVID-19. So they would appropriately move to conduct the tests. And fortunately, in Japan, CT penetration is world's #1 in Japan. So if pneumonia is suspected, not only X-rays, but CT scanning is done because there's a high penetration rate. And if you discover a pneumonia due to this, they would move to the next test. I think that's the course. So therefore, if someone dies in a hospital due to pneumonia, there may be exceptional cases, but for most of the cases, I believe that the diagnosis is made appropriately.
Thank you, Mrs. Hara. We have some questions relating to ICT technology, and perhaps we can bundle these two questions. One is from Ms. Motoko Rich of New York Times, which is, can you describe your proposals for ICT contact tracing in more detail? And the other question is from Mr. Patrick Welter of Frankfurter Allgemeine Zeitung. Does Japan see a need to develop or introduce a contact tracking application on mobile phones as it is discussed or introduced in Germany, Australia, New Zealand, etc.? If yes, which public institution developed such an app, and when could it be introduced? And if no, why don't governments see such a need? So maybe I can ask both Mr. Kojima as well as the Ministry of Health, Labor and Welfare to deal with this question.
Yes, thank you for the questions. or respond. As part of counter-cluster measures, utilizing ICT, is something that we need to tackle as government of Japan. On the 4th of May, as part of the Japanese government's basic policies, there's a clear description with respect to the use of ICT. So inclusive of using ICT on contact tracing, we would like to see such technology being promoted. And of course, the whole of the government will address this with the relevant ministries involved, and development is now underway for this. And such apps are being introduced overseas, but we have to consider the implications on privacy protection, personal information protection. So we have to make sure that personal information privacy is adequately protected. That should be the assumption. And this has to be accepted by the general public of this country as well. So that needs to be ensured system-wise. And that is how this needs to be developed. That's the position of the Japanese government. Over to MHLW. So promotion of measures utilizing ICT, if I may share information on that. At our ministry, what we are pushing for is as follows. Information about medical institutions as infections spread. We have to have the healthcare capacity. And in ensuring that, we need to understand the status of each hospital. What is the number of beds in that particular hospital? What is the number of beds that are vacant or available? Or what is the status of medical equipment, the medical staff, how they are allocated, and what is the availability of PPEs? What is the status of procurement, outlook on the procurement of PPE and other materials? By collecting data on a weekly basis, we will be able to establish appropriate healthcare system to meet the needs of the times. Ever since we've had an outbreak of this epidemic, we've been doing this, but it takes a lot of effort, and this work is very complicated. So as we collect the data and disclose the data using ICT, collecting information on a unified basis and supplying, disclosing information, we've been doing that already since April. And as far as information is concerned, if there's a patient that's detected, the patient information, how the test is conducted, what are the attributes, their name, their age, their occupation, starting from those basic pieces of information and the test results of that particular person. Or is the person having a severe case or a mild case? In which hospital is the person is? Or is the person at their home? Is the person being treated elsewhere? So patient-related information. The local government or the local health center or the national government, we need to grasp that information so that we can share the relevant information necessary with respect to the patient. We've been collecting such data to grasp the situation and analyze the situation. And that takes much effort. And so by utilizing ICT technology, we're trying to unify that data collection effort, consolidate data collection effort, and by promoting this type of initiative, the workload related to disease control, especially at the local government level, they will be able to reduce the workload. So that's our hope, to see this type of technology being used.
Okay, thank you, Mr. More questions? Oh, yes, Nishimura-san.
再び
Nishimura once again. This is according to recent information in France. In December, there were already those infected which were hospitalized, and it was confirmed recently. And in November, also in November, there are those who lost their sense of taste, and there were those who were hospitalized with influenza-like symptoms. And these people perhaps had been infected in November. There is such a possibility, and there are studies to this effect. In Japan, do you have cases where symptoms were unlike the ordinary influenza, the people who have lost their sense of taste? Have you seen this in Japan at an early point in time? And is there any research underway concerning this?
Question for the Ministry of Health.
あの
The case in France is something that we entertain a great interest in. We think that it's deeply interesting, and we want to obtain more information. Using different channels, we are collecting information. And as to whether similar developments are seen in other countries, we are in the process of collecting information. And similar research, I think, is called for in Japan. But at the present point in time, we haven't gone that far. If you ask whether we're doing anything specific, we're not. We are not. And the report from France is something that we have a great interest in.
Okay, you have a question?
Thank you very much, Rocky Swift at Reuters once again. Among Japanese developed drugs to combat the COVID-19, Ativan is the most well-known and most popularized. But another drug that I've been hearing about is one called Camastat mesylate. It's known commercially in Japan as Foipan. I was wondering if someone from the health ministry can comment on that, whether you've heard any anecdotal evidence of this drug used in hospitals, and if you can perhaps comment why this drug maybe has not gotten as much attention as Ativan. Thank you very much.
Thank you, Rocky-san. Can I ask Umeda-san to take that question, please?
Regarding Ativan, earlier, Mr. SAHARA explained, and another drug, ivermectin. It's used for parasite. And ivermectin is the name that is used in Japan. As you know, Dr. Omura, who is a Nobel laureate, was involved in developing this drug, so it's well known. And the efficacy of the drug was confirmed and reported, and we are aware of that. Going forward, regarding ivermectin, at Kitasato University, a doctor-led trial is being planned, so efficacy will be confirmed once again in that trial. From what we're told. So, Ativan or ivermectin, the drugs developed in Japan, these new drugs that are potentially effective for COVID-19. And so we would like to verify that some of these existing drugs are effective, and if they can possibly be used for treatment, we would like to continue with the developments.
ご質問が
I believe the question concerned nafamostat. Nafamostat. I believe that's what the question was about. カモスタットの方。
カモスタットか。カモスタット。
Please use the microphone.
すみません、今そちらについては詳細な
I don't have the details on that, so I'd like to provide you with details later.
A question actually from Isabel Reynolds of Bloomberg, which is in particular, when will foreign residents of Japan be able to leave and return again? I think I'll take that question myself, and I think the answer would be rather similar to what I said earlier. It would depend where that person wishes to travel to and forth. It will depend on the situation in that particular country. It will also depend on how things are in Japan as well. And the availability of flights can also be relevant as well. It's difficult to say in general how things will change in the near future, but as I mentioned earlier, the government, including the Foreign Ministry, is looking into how the travel advisory and other restrictions on travel should be evolved in response to what is happening in Japan as well as what is happening around the world regarding the COVID-19. So in a nutshell, it's at this point in time, it's difficult to give you a concrete answer on when, but we will be looking into it. So if there are no questions, I believe there are no more questions coming from the online viewers. Oh, but we do have Mr. Sahara who wishes to make some remarks.
Kamosa that was asked about. Ono Pharmaceutical developed this drug. At University of Tokyo, using cell line in vitro testing is being conducted. Is it effective on humans? That is yet to be found. More research is necessary. That's where we are right now.
So I think our conference, our meeting is drawing nearer to a close, and I have addressed all the questions from the floor as well as online. And if there are no further questions, I think it's time to conclude this conference. Before I do that, I do realize that some of the questions were very complicated, and we hope that we've been able to give you the answers that are clear enough. But if not, do not hesitate to contact us through the Foreign Press Division in our Foreign Ministry, and we can answer the questions one by one on a one-by-one basis as well. But in any case, we hope to see you again in the near future. We will be conducting this periodic press conference from time to time, and we'll be seeing you soon. Thank you so much.